Hello, my name is Julian and welcome to The Secret Mind. And this is The Secret Medic. So today we're talking about a purely medical subject, which is going to be peanut allergy and what I'm going to refer to as the peanut paradox. Now, last week, you may have seen on the news, there was this article in the BBC, widely reported from a journal, "Give babies peanut butter to cut allergy by 77%, study says." That might be quite a leap of imagination for a lot of people. So I just wanted to go back into where that comes from and how legitimate that is, and if we can embrace the change if that's necessary. And this is the paper that it came from, Defining the Window of Opportunity in Target Populations to Prevent Peanut Allergy. And this is based on research and information that's been around for quite a while now, that we've been a bit shy of peanuts. The background to it is that peanut allergy affects 1 to 2% of European children, and the early introduction of peanut into the diet reduces allergy in high-risk infants. The early introduction, so not the avoidance of it. So this is where we come in. So let's just get the context of where this peanut allergy has come from. Everybody seems to know that food allergy is increasing, isn't it? Well, yes, it is. So this scale, it doesn't say it on here, is over a 20-year period between 1998 and 2018, from the left to the right of the graph. And you can see there's hospital admissions on the y-axis per 100,000 population. You can see how they increase steadily and consistently over the 20 years that the study looked at. And that's in all age groups, but particularly the younger age group. That top line is the 0 to 14-year-olds. And this is the admission from all causes, admissions to hospital as a result of anaphylaxis, the most severe representation of allergy, where your tongue might blow up, your blood pressure might drop, it might be fatal. And that is has been slowly increasing and steadily increasing. Now, this is also another graph. You can see the 20 years down at the bottom there. Food-induced anaphylaxis rising. So the most severe allergies rising quite steeply, particularly in children, up to the age of 14, that top line, remember. So something is happening, isn't it? Something is going wrong. This is another graph of food anaphylaxis in the United Kingdom, 1998 to 2018. The good news is that fatality is coming down. So the people who are getting admitted to hospital are getting some treatment. What's that going to be? That's going to be probably some adrenaline, otherwise known as epinephrine, probably some steroids, maybe some antihistamines, but getting treated, and the fatality is coming down. But the burden of illness that they might be carrying, the inconvenience to their life, the other aspects such as maybe eczema, causing them long-term problems, that burden of illness has got very high because the rates are steadily increasing. So at least the hospitals are doing the right job at the end stage, but can we do better? Now, this is a little graph in children. On the purple section is peanuts, and this section is tree nuts. I never heard the phrase tree nuts until I went to seminars, medical seminars. So let's just look at a tree nut. What is a tree nut? Tree nuts include almonds, Brazil nuts, cashew nuts, hazelnuts, walnuts, pecans, pistachios, and macadamia nuts. And there are two types of tree nut allergy. The first type is known as a primary food allergy, where a person becomes allergic to the nut through direct contact. Although the severity of the allergy can vary, it can cause a severe life-threatening reaction. And we're just going to focus on that one today. But the second nut, the second type of allergy, is a more long-term sensitization that causes people non-life-threatening but troublesome symptoms. So these are the tree nuts. And remember, here we are in children. This top upper right quarter of the graph is nut related. These three segments, purple, yellow, and pink, 14%, 9%, so quite substantial. Milk allergy is the blue one. Cow's milk allergy we can talk about on another occasion. This is our old friends, the seafood shellfish, obviously a popular allergy. And this upper left quarter is unknown. In adults, nuts are even a bigger player. 20% peanuts, tree nuts 9%, unidentified nuts 23%. So more than half of adult allergy. So it's a substantial burden. Let's look at this study then, as it was widely quoted, and it took data from two studies, the EAT study and the LEAP study. You can look them up if you want to. Not huge numbers, 1,300 and 640, but they had a 5-year follow-up. It was randomized controlled data, the highest quality, published in a peer-reviewed journal. That's what we're looking for in evidence. And the data included participants with any risk of developing peanut allergy, and follow-up data from participants who did not even fulfill the criteria for one of the studies they were looking at. So they looked further and deeper, and they had a decent test. They defined their allergy by not just hearsay or word of mouth, but by a blinded peanut challenge or a diagnostic skin prick test result. So a substantially scientific, verifiable method. So when I read that, I was quite reassured this wasn't just done on hearsay or questionnaires. Remember, people aren't often sure what they're allergic to. Look at those. Remember those pie charts from a moment ago where a big portion of it was unidentified? What's going on there? Who knows what to believe? So they verified their allergies in a good, decent scientific way. So they estimated there'd be a 77% reduction in peanut allergy if you started introducing peanuts to all children, even without eczema, that being a skin condition that might be the result of an allergy, all children at 6 months. But if they've got eczema, even earlier, at 4 months. So the early introduction of peanut products was most effective when it was applied as early as possible. And why not earlier than that even? And some people are pushing for that now. In Israel, a culture in which peanut products are commonly introduced early into the infant diet, peanut allergy is rare. So the other interesting factor, which I didn't know, was non-white ethnicity was associated with a greater development of peanut allergy during the first year of life. Combining the data from the two studies they looked at, they were estimated to have a higher likelihood of peanut allergy compared to white infants, and the relative risk, that's the RR, was more than 2.2, so more than double. So very substantial. Let's just have a look at another graph here. This is this is the EAT study that it refers to on the left. The avoiders, look in the avoiders queue, the people who avoided, I think, right at the top, the risk of peanut allergy much more substantial than the consumers on the right-hand side. You can see all those red areas in very high risk and high risk and medium risk of peanut allergy. All of them, if they avoided it, they were worse off. Again, when peanuts were introduced closer to 11 months than to 3 months, then the eczema duration, the milder symptoms, probably the second type of allergy that we mentioned, causes very substantially more persistent symptoms and more misery, really. And again, similar sort of thing looked in a reverse way. Prevention is high when the peanuts are introduced towards 3 months of life, and if the delay is to the kids getting no peanut based material in the first year, then the prevention of allergy is down, what's this, 20, 30, 40%? Very, very marked. And this is the point, that most peanut allergy has already developed in the first year of life. So after the first year, to a large extent, if you haven't introduced peanut-based material, you've missed the boat for life. Or your kids have. Or your patients have. So this is what I'm calling the peanut paradox. Because why is this happening? And this is a commentary which shows you alternative hypotheses can be made to explain these findings, that food allergy has become more clinically manifest than in the past, so that food anaphylaxis is increasing. But we've become better at treating it. But Occam's razor, that being that the simplest solution is likely to be the correct one, we should favour a simpler explanation, that we live in an era of increasing concern and awareness about food allergy, but we are not in the midst of a food allergy epidemic. Remember, the fatality rates in hospitals for severe cases was falling consistently through better treatment, maybe EpiPens, things like that. So clearly, we must continue to do all we can to alleviate the burden of living with food allergy by developing more reliable diagnostics, etc., etc. But overdiagnosis of food allergy or anaphylaxis does not usefully contribute to this and places an inappropriate burden on those who are mislabeled. So the paradox is that over several decades, the deliberate avoidance of peanut has led to parental fear of early introduction. And now we've got ever rising kids with skin conditions through peanut allergies and rising cases of anaphylaxis. Not fatalities, but still a troublesome burden to carry when it can be clearly prevented. So what are our conclusions? That there is a narrow window of opportunity to prevent allergy in the first year, preferably in the first 6 months. Will we get to 3 months, 2 months? Where do we draw the line? So the indication at the moment seems to be, broadly speaking, the sooner the better. But the guidance is coming down now to, well, we'll go for that in a second. So it's most time critical in kids who have eczema. Exactly the ones who might avoid things that might be allergic are the ones that need to be exposed to those allergens to avoid a lifelong burden of allergy. And most time critical as well in the UK in non-white infants. Remember, they had more than double the risk of developing these troublesome allergies. Even early introduction of peanut products to all children by 6 months would fail to prevent the development of an allergy in a substantial proportion of infants with eczema. So even by 6 months, in other words, earlier is required, particularly if you're more likely to be getting it. That's the thing that's going to be difficult to get people's heads around. If you're more likely to have these problems, you need more to be exposed to these allergens so that you can body when it's got its young immune system that's still learning, can arm you against these otherwise unexpected things that come at you later in life. So in countries where peanut allergy is a public health concern, healthcare professionals should help parents introduce peanut products into their infant's diet at 4 to 6 months of life. So that is the current sort of recommendation. And I say some people are pushing for that earlier, and that seems to be credible. The 2021 European Academy of Allergy and Clinical Immunology Prevention Guidelines suggests 4 to 6 months if there's a high prevalence of peanut allergy. So peanut allergy has become so common that some schools are banning the ingredient. There's been long-standing advice to avoid foods that can trigger allergies during early childhood. At one point, families were once told to avoid peanut until their child was 3 years old. So this is the disastrous situation we found ourselves in. Nothing harms like good intentions sometimes. That itself is a bit of a paradox, and it involves some unwinding, particularly in terms of health professionals, to give the right advice and not maintain the old advice. Professor Graham Roberts from the University of Southampton said decades of advice to avoid peanut had understandably led to parental fear of giving children peanut, and shifting rules led to large amounts of confusion from both within medicine and from parents. He said this was a simple, low-cost, safe intervention that would deliver vast benefits for future generations. Pretty appealing. So this is the action that needs to be taken. It's best to intervene in the whole population. This is a population measure, public health measure, really. It should go to their department to get the word out if they can. And the word being, applying early introduction of peanut to a whole population requires considerable education of healthcare professionals and families, with detailed advice on weaning strategies and addressing families' concerns, because it's going to be the opposite to what they want to do. And that is a difficult message to sell. That is the peanut paradox. And the clinical implication then, just to repeat, is to avoid peanut allergy, all infants should start eating peanut products by 6 months of life, and infants with eczema, other sensitivities that indicate they might have an allergic tendency, even earlier, from 4 months of age. But there is a danger of a further paradox. You've got to be aware of unintended consequences when you change advice. So, for example, parents deciding to give their infants whole nuts, leading to nut inhalation, is not something that we want to do. So this is where the information comes in. We need to stress the need to introduce peanut products such as peanut butter or peanut puffs. I don't even know what a peanut puff is, but not the whole nut. That probably can't be laboured enough. The immune system is still developing, and this is therefore what will help the immune system to recognise friend from foe. And this is the way we're going to reduce the allergic reactions. And the peanut butter or peanut puffs, this is some advice. When baby is comfortable, around 3 teaspoonfuls of peanut butter a week should be introduced and maintained for years. Peanut butter, which can be quite dry, can be given with breast milk. So I bet the peanut butter companies are going to be delighted about that and getting on the back of that one. So they're probably the one that gets the message out before anybody else. But there we are. So they are, just my final thoughts are, these are formative things that happen to you in your first year of life, with the best intentions, I'm sure, from parents who might be protecting their children from some potential allergy, but in fact end up doing them inadvertent harm for their entire lives. That is a very particular thing with the way the immune system grows up, but I wonder what other fears and avoidances are installed in the first year of life, in all aspects of our life. It's not just your immune system that's listening. So there are some references below to this little discussion. Please like and subscribe if you want to hear more of this sort of stuff. If you've got any comments, please do comment. And I hope you found that of some use or value. And thanks for listening. See you tomorrow.